Hey guys, John T. Hickman here. Welcome to today's very special video where I will be showing you exactly why IFS therapy, mindfulness meditation, is very effective to getting lasting relief from chronic symptoms, and I'll be doing so with a whiteboard by sharing my screen. This is something that I do for people that I see one-on-one over Zoom. Anyone that has watched my videos before knows that I give a lot of lectures about why things like IFS therapy and mindfulness can be effective to healing chronic pain. This video is dedicated to anyone that's more of a visual learner that needs to see exactly what it could look like visually as to why we're getting relief from chronic symptoms using these tools. By the end of this video, you're going to learn exactly why these tools can help get lasting relief from your chronic symptoms: back pain, stomach pain, migraines, anxiety, depression, dizziness, tinnitus, fatigue, any disharmony in the mind or body. You're going to learn exactly why these tools are effective. You're going to learn what to expect from doing these tools. You're going to learn why the tools differ, IFS therapy and mindfulness. I'm going to show you why IFS therapy helps you learn how to meditate. So anyone that's learned anything about the mind-body approach, you probably already have heard multiple times by me and all the other practitioners that meditation is an effective way to get lasting relief from your symptoms. But a lot of people get stuck. A lot of people get stuck trying to learn how to meditate by themselves. IFS therapy with a practitioner like myself or another IFS therapist is an effective way to teach you how to meditate, because it teaches you how to identify what's arising for you and what to do with what's arising for you. So in this video with the whiteboard, I am going to show you exactly why. So let's get into this. I'm going to start by let's start with IFS therapy. So I'm going to write IFS therapy at the top, and I'm going to show you exactly why IFS therapy can be effective to healing chronic symptoms. So the way that I often like to depict this, I show this to people after we've done an IFS session so they understand what's going on. So in an IFS session, typically the person will close their eyes, and as their eyes close, I'll ask them what's arising for them. And it could be a multitude of things. Some people, they'll notice their pain immediately. Sometimes they'll notice a fear. Sometimes they'll notice nothing. Sometimes they'll notice just thoughts. So they may notice a whole variety of things, a handful of emotions or no emotions, lots of pain or no pain. But let's just, for this example, say that when you close your eyes, when the person closes their eyes in the IFS therapy, the first thing they notice is pain. So I'm going to write this in the circle. So first thing the person notices is pain. Without IFS therapy, someone notices pain and then they're maybe panicking towards it, they're trying to fix it, they're trying to figure it out. They are very invested in the pain, they're very focused on it. And the circle right now represents their focus. And you're about to see that I'm going to expand the circle as the IFS therapy continues. But at the beginning of the session, the circle is quite small and all they're focusing in on is the pain. And as the session continues, the circle is going to get bigger, and the circle getting bigger represents a couple of things. It represents the sphere of awareness, or being more aware of things arising for us, and it also represents the nervous system regulating. So as the IFS therapy session starts, the first thing the person notices is pain. Let's say the person notices pain immediately, and I'll ask them how they're experiencing the pain, how they're noticing it, and they'll say tightness in the chest maybe. Tightness in chest. And they may notice that, I can keep writing, they may notice tightness in chest, they may notice that it's to the left side, they may notice it intensifies when they focus on it. So these are questions I'm asking the person in the IFS therapy itself. I'm saying, how are you noticing the pain? They're saying, I'm noticing it as a tightness in the chest. And I'll say where, and they'll say it's on the left side. I'll say what happens when you focus on it. They'll say it intensifies. So I'm asking the person these questions. So they're getting curious about their pain. They're noticing it. And then after asking them all about the symptoms that they're noticing or the thing that they're noticing, and they unpack it a bit, I'll then ask them how they feel towards what's arising for them. And usually people do not like the symptoms that they're experiencing. Usually they'll say something like irritated towards it. Or maybe they'll say they're fearful towards it. But let's just use this example of irritated towards it. And then, so they become more aware of more things. So the circle gets bigger. Their circle of awareness gets bigger. They've noticed pain. They're noticing how the pain is showing up for them. And then I ask how you feel towards the pain, and they notice that they're irritated. And then I'll say, how do you notice that you're irritated? How do you know that you're irritated? And they'll say maybe it's thoughts. Maybe their thoughts are telling them this is annoying me. Maybe they'll notice the fact that they're irritated because they'll notice a feeling in their body, a feeling of restlessness maybe will tell them. Or maybe it's thoughts will tell them. Excuse my handwriting as I go through this. They'll notice that they're feeling irritated, and I'll ask them to unpack this irritation and how they're experiencing that irritation. And they'll kind of say, I'm feeling a bit restless. That's how I know I'm irritated. I'm noticing thoughts that are telling me I'm irritated. So within a couple of minutes, the circle of awareness is getting bigger. And because the circle of awareness is getting bigger, the nervous system is regulating bit by bit. I'm not saying that within 5 to 10 minutes, the pain goes away as soon as you notice the irritation. What I am saying is you're beginning to teach the mind and body through this process very quickly that I'm becoming more aware of what's arising for me, and I'm starting to validate what's arising for me. I'm starting to unpack it. I'm starting to notice why I'm irritated, because I'm feeling restless. Restlessness, is it 2 L's? I can't make this bigger. Yeah, I can. I'm noticing because there's thoughts. So it's not that things immediately get better, but you're teaching the mind and body from the get-go that I'm beginning to notice more. I'm beginning to notice more about how I'm feeling. And something you learn in the IFS therapy process, as well as the mindfulness process, is it doesn't matter why we're irritated or why we're afraid. The subject of the emotion doesn't matter. It doesn't matter if we're irritated at the body. It doesn't matter if we're irritated at someone that we don't want to be irritated at. It doesn't matter if we're fearful of whatever. The mind and body doesn't mind about the subject of the emotion. It just wants us to validate the emotion. It wants us to allow it to be there. It wants us to feel okay with it. It doesn't matter if the emotion is unhelpful. It doesn't matter if it's irrational. It doesn't matter if it's inappropriate. It wants us to tell it whether or not it's safe to feel or not. And in the IFS process, by acknowledging how we're feeling and beginning to notice why we're feeling that way, that's what you're teaching the mind and body. It's okay that this emotion is here. It's okay that this emotion is here, regardless of whether or not we feel it's unhelpful or irrational. And doing so teaches the nervous system that more of our experience is safe. Then what will usually happen very quickly, so there's been pain, they've noticed how the pain is showing up, then they notice they're irritated towards it, they notice how they're irritated, why they're irritated, I ask them why, they'll say, because, maybe they'll say, because pain is annoying, maybe they'll say something like that. And then I'll ask them, okay, how do you feel towards the presence of irritation? How do you feel towards being angry right now in your body? And very, very likely, this is where you begin to learn the fact that you're repressing, because a lot of people do not like experiencing emotions that are uncomfortable. So straight away in the IFS therapy process, it can be within 5-10 minutes of the first session, you will have noticed your symptoms when you close the eyes, then you will have noticed the fact that you're irritated and why, and then you'll notice the fact that you're resisting your irritation. You don't like it being there. You don't want to feel irritated. You want to feel comfortable. You want to feel relaxed. And the beauty of the IFS therapy process is we then do exactly what we've done every step of the way. Instead of telling resistance, go away, we need to learn to let ourselves feel irritated. We ask the resistance, why is it resistant? And it will say, because anger is scary. Or it will say, as in it's resistant towards the irritation. It will say, I don't like feeling angry, it's scary. Or, I want to feel comfortable, it may say. When I say it may say, this is very much a conversation I'm having with the client. It's very much the conversation I'm having with the person in front of me. I'm asking them these questions and they're replying. I'm saying, why is there a part of you internally that feels resistant towards the irritation? I'll say, because I don't like feeling irritated. It's not comfortable. I want to feel comfortable. And what we're doing with this resistance, exactly what we've done with the pain, what we've done with the irritation, is we're beginning to validate it. We're beginning to ask it why it feels the way that it does. And it says why. And through this whole experience, as we've gone from one thing to the next, the circle of awareness is getting bigger. You're teaching the mind and body gradually that more of what's here, I'm noticing more of what's here. And usually by the time that someone gets to their resistance, their fear towards what's arising for them, usually this is at the point when someone says, I can understand why I'm resistant. I can allow this to be here. The central objective of the IFS therapy process is to learn to acknowledge more of what's here and to learn to allow more of what's here. And so bit by bit in the IFS therapy, we're acknowledging one by one what's here, and we're doing so in order until we're able to allow the thing that's here. And usually by the time we get to the person's resistance, and I ask them, can you understand why you're resisting your anger? Can you understand why it's scary to you, why you want to feel comfortable? Usually someone will say, yes, I can understand that. And they're able to begin the process of allowing. And what that looks like in IFS therapy is simply me inviting them to say to themselves internally, I understand exactly why I'm resisting this. It makes sense that I'm fearing the fact that I'm irritated. I'm fearing the fact that I'm in pain. It makes sense that this is here. And in validating their resistance, lots of different things can happen. Maybe they'll notice more fear arising. Maybe they'll notice themselves suddenly start to cry. Maybe they'll suddenly notice that the breath feels constricted. So maybe they'll notice more of the symptom. Maybe they'll notice things calm down. But what will happen when one by one we're acknowledging what's here, we slowly but surely begin to affirm to ourselves that it makes sense what we're feeling. This starts happening more and more. And the nervous system starts to open up more and allow more to flood in. And what could flood through could be that you feel more relaxed in the moment, or it could be that you suddenly, when you've allowed yourself to feel a bit of fear in that moment, it could be that sadness suddenly arises. I'm not saying this is how it happens for everyone, but this could be what happens. Infinite things could happen. Or it could be, like I said, it could be that suddenly the breath is constricted. It could be that you feel more relaxed. Suddenly. A lot of people, as soon as they start allowing something, they suddenly feel relaxed. What I'm trying to allude to is in the IFS therapy process, one by one, we're learning how to acknowledge more of what's here, and we're also learning how to to allow more of what's here. And in doing so, we notice that more starts to flood in. Suddenly sadness will start to arise, and suddenly maybe we feel relaxed for a couple of moments, or maybe the breath feels constricted. And it doesn't matter what arises. I'm not going to write more here because it's going to get too busy. It doesn't matter if sadness then arises. We then turn towards the sadness. What stands in the way becomes the way. You know, how are you experiencing the sadness? I'm experiencing it as tears, or I'm experiencing it as a constriction in my throat. And, you know, how does it feel that it's here? Well, I feel afraid towards it. So maybe there's a fear towards the sadness, then turn towards the fear. Why is there fear towards the sadness? Well, it's scary to feel this way because I want to feel comfortable. Sometimes it feels like it's going around in circles. But whatever is here in any given moment, we acknowledge it and we allow it. I know I've written everything in a big circle. In the IFS therapy process, it's not like we have to be concentrating on everything at once. It very much acts like a carousel. You focus on one thing at a time. The more that we focus on each thing, acknowledge that it's here, notice how it's showing up, do our best to allow it, notice if there's resistance, see what happens if we're able to allow the resistance and allow the thing that we're resisting. Things may go out of control, things may get chaotic, our attention may suddenly go somewhere else completely different. What we're learning in the IFS therapy process is how to acknowledge what's there, more of what's there, how to allow more of what's there, and to generally be okay with the fact that it's going to feel out of control. It's going to go in lots of different directions. And one by one, no matter what shows up, we acknowledge it and we do our best to allow it. And by doing so, we're gradually teaching the mind and body that we're aware of more things, and we're teaching it that it's safe that we're experiencing this. When you first start IFS therapy, a lot of people think nothing's going to come up. And even if nothing comes up, I'll do a depiction of what it looks like when nothing comes up. There's still a lot there. First and foremost, they think this isn't going to work for me, and it very quickly does. And also when people start IFS therapy, they really begin to notice that, wow, there's so much here that I've not let myself feel for so long. And going through the IFS therapy process, you begin to learn that one by one, your nervous system is always trying to get you back to equanimity. It's trying to show you, let yourself experience sadness. Let yourself experience fear. Let yourself be resistant to the sadness and the fear, and allow that to be there as well. Because maybe you needed to be resistant to your sadness and fear once upon a time. And so validate that part of your psyche as well. Validate all the contradictions and the paradoxes one by one. You don't have to do it at the same time. One by one, with the help of a facilitator. And in doing so, you'll teach the mind and body that more of your experience is safe. This expands your sphere of awareness and teaches the mind and body it no longer needs to give you symptoms. Sometimes in a session, it can be pretty immediate that you'll notice the rising and falling of symptoms. At the beginning, they've noticed pain, and then 5, 10, 20, 30 minutes in, they're noticing all these different things. The pain suddenly is in the background. They're not noticing it as much. And they begin to discover the whole purpose of pain showing up in the first place wasn't to hurt you, but it was to get you to learn how to feel irritated, to learn how to validate your resistance, to validate your fear, to validate anything arising for you. So it's not an accident that you're irritated at the body. It's not an accident that you're fearful of your pain. The pain is showing up on purpose to trigger these emotions in you. It knows if we give Jonty, let's use me as an example, if we give Jonty pain, he's going to feel the very emotions we want him to feel, because he's not letting himself feel anger at whatever it is in his life. Often in the IFS therapy process, the anger or the fear will go back to childhood moments. It will latch onto stories of the emotion to help you access it more. People learn about IFS therapy and they think they need to go back to each traumatic moment in their life and resolve it somehow. It's not entirely true. The subconscious will use the stories of our past because it knows it will trigger a big emotion in us, and it wants us to learn how to feel that big emotion. The story doesn't matter as much as the emotion matters. So it doesn't matter if every time we go into IFS therapy, the mind uses that moment when we were 5 and we were bullied. It doesn't matter if it keeps taking us back there in order for us to feel our anger or embarrassment or shame. It's just doing it because it knows that will trigger that emotion in us. If that doesn't make sense, then don't worry. You can always ask questions about that in the comments below, or maybe you've understood it and then that's fine. But to summarize IFS therapy before we get into mindfulness, the purpose is to acknowledge and allow more of what's here. It's very purposeful what's showing up at the beginning of a session. If I can do this, this is usually what someone is experiencing. They're doing this, and they've probably done this for a long time before they've seen me. Their circle of awareness is just isolated to pain. They don't realize that all of this is trying to get their attention. And the IFS therapy gradually teaches them how to pay more attention to what's here. I didn't do that very smooth. And in paying more attention to what's here and learning to validate more of what's here, your circle of awareness gets bigger, you allow more of what's here, and that has a regulating effect on the nervous system, which in time leads to symptom relief. Rewind this if you need to go through anything else again. And then they come back to another session and that whole process maybe starts again. Maybe the first thing they notice, a lot of people notice in a session, they'll notice nothing. They'll come to me and they'll notice a lot of nothingness. And then they'll think there's a problem. They'll think, oh, I've got to notice something for this to get better. But it's the same. It's the same process. How are you noticing nothing? Well, my body's numb. So, we just unpack it in the same way as we did with the pain. The body, so there's numbness. That's how I'm noticing nothing. How do you feel towards the fact that there's nothing? I'm irritated. The fact there's nothing. Why are you irritated? Because I'm restless and I want something to happen so I can get better. How do you feel towards being irritated? I'm resistant towards it. It's the same. It doesn't matter what someone comes with. Doesn't matter what they're experiencing. We're learning to allow sensations, allow emotions, allow the breath to feel however it wants to feel. The breath can feel however it wants to feel. So that's IFS therapy. It obviously helps to do it with someone. A lot of people try and do it by themselves. All the best to you. If you can, then that's wonderful. But I was never able to. I had to see a therapist, and I became one because I was so inspired by the process itself. It can help to really see someone with this, but by all means try and do it yourself. I have other videos about it as well, if you'd like to. And like I said before, IFS therapy is a good way to teach you how to access mindfulness meditation. So let's go into mindfulness meditation, because after all, like I said before, there we go, it can line up nicely. IFS therapy, in my opinion, is an extension of a mindfulness practice. Richard Schwartz, the founder of IFS therapy, found this amazing therapeutic modality which could help people with an already amazing tool, which was mindfulness meditation. A lot of people have been taught, particularly in the West, that mindfulness meditation is all about relaxing. It's learning how to calm down. It's a place of soothing. And there's a lot of value to using meditation like that. But that's not how we use mindfulness in the process to getting lasting relief from symptoms. And one may argue that the traditional usage of mindfulness was not one where the objective was relaxation. The traditional use of mindfulness before it was marketed differently to the West wasn't about relaxing. It was about learning to acknowledge and allow what was there, which is anything but relaxing. Your mindfulness practice, even though your eyes are closed and hopefully there's quiet around you, is all about acknowledging what's occurring for you in the mind and body and learning to allow it to be there. And often what's occurring for you, particularly if you have chronic symptoms, is a lot of discomfort. There's pain in the body, there's restlessness in the legs, the breath is constricted, then there's fear, and then back to restlessness, and then there's anger, and then you're feeling doubtful, and then you're feeling confused, and then you think you're doing it wrong. Going inside and closing the eyes is a whirlwind. It's a lot. And if you've been taught that meditation is about trying to relax that, calming it down, you don't actually end up doing what we need to do to get lasting relief from chronic symptoms, which is to learn to acknowledge more of what's there and allow more of what's there. Because we need to teach the mind and body that the restlessness is safe, the fear is safe, the constriction in the breath is safe, the anger I'm experiencing is safe, the doubt I'm experiencing is safe. Your mind and body wants to feel the full spectrum of emotion. And mindfulness is a practice where you learn how to do so. It's an amazing antidote to modern day life, because in modern day life, we have been taught, I'll get into the visuals of the mindfulness in a moment, but let me just, on a tangent, say what I want to say. In modern life, we've been taught to bury emotion. We've been taught to resist. IFS therapy shows you very quickly that you have been conditioned to resist your emotions because you don't like them, because you want to feel comfortable. Modern society teaches us that we must be comfortable and convenienced at all costs. It's taught us, in the UK, we call it a nanny state. You're looked after and you have to always be comfortable, and if you're not, you're doing something wrong. You have to be happy, and then you're doing something wrong. If you're sad, you need to learn to move on from it. If you're angry, you need to calm down. If you're afraid, you need to learn to be more confident. There's no space in modern world where we're taught to be civil and kind at all times to allow ourselves to feel the very emotions that your mind and body wants you to feel in order to get lasting relief from chronic symptoms. Your mind and body wants you to feel the full spectrum of emotion because it knows when you learn how to do so, number one, they won't overwhelm you and kill you and last forever like we've been taught they will. But by accessing the full spectrum of emotion, by learning to allow yourself to feel fear and anger, etc., you actually access more of your intuition. You start to live on your terms more. People come to me in pain, and gradually, but surely, but gradually, I teach them how to acknowledge and allow more emotions that they haven't acknowledged and allow in their life. And then they start making other decisions in their life, not because I've told them to, but they start to, by allowing themselves to feel afraid and anger, etc., and seeing that the lifespan of the emotion rises and falls fairly quickly, they suddenly start to question their job. And they start to, I don't want to do this job anymore. Or they start to question their relationship and go, you know what? I need to speak up for my needs and boundaries more. They start to make decisions in their life that are more aligned to who they actually want to be. And that came from allowing more of their experience. And that comes from going through the IFS therapy process and learning how to utilize mindfulness as a self-practice in the more traditional sense. Not in the way to relax us, but in the way to acknowledge and allow more of what's there. Now, I'm going to show you again how the mindfulness practice works and how it differs from IFS therapy. But I do want you to know that the mindfulness practice, we do it daily, is a dedicated space where we allow ourselves to surrender to the sadness and the fear and all the uncomfortable emotions showing up. But that doesn't mean that in everyday life, just because we're allowing anger and sadness and mindfulness, it doesn't mean that we've got to suddenly start shouting and screaming and crying and being afraid at work and with our partner, etc. There's still value to being civil and kind and lovely in everyday life. But then your mindfulness practice to practice becomes unique. It's a dedicated space called a safe space where we suddenly start to allow ourselves to feel all the emotions we didn't let ourselves feel the whole day or in our ordinary life. So I just want to make that distinction. Just because we're allowing big emotions, it doesn't mean you suddenly need to start screaming at people just so that you can get relief from your chronic pain. The meditation, 20, 30 minutes a day or however long you have, even if it's 5 minutes, is the time when you allow yourself to feel the very emotions that maybe rightly so you don't want to be indulging in everyday life. Anyway, let's get into the mindfulness practice and how it's same, but also a bit different to the IFS therapy. So let's say in your mindfulness practice, you sit down to do a meditation. So this is your self-practice. You close the eyes, and let's say again, the first thing you notice is pain. Now, the difference with mindfulness self-practice is what? You don't have an IFS therapist there helping you identify what's there and helping you unpack what's there. So what's different about a self-practice compared to IFS therapy is that you don't have someone there helping you identify what's there, and you won't necessarily have the same sort of dialogue with it. In IFS therapy, I'm there asking you questions about what's showing up, and you're replying back about what's showing up. There's a dialogue happening, and you very much learn how to talk to your system and how to be with it. And then it gets to a self-practice, and the dialogue is different. It feels weird. You're just there talking to yourself, or you don't have me there helping you really dial in on what's happening. So you get to your mindfulness practice, you experience pain, and then you're like, what do I do? How can I use my IFS therapy practice in my self-practice, in my mindfulness when I'm by myself? And very much what we learn in mindfulness is to return to the body over and over again and to learn to just accept the state of being that the body is in any given moment. So let's say the first thing you notice when you close the eyes is you notice pain in the body. So the first thing you assess to yourself is, can I allow this pain to be here? Can I just let the constriction in the chest be here? You can get curious immediately. You can say to yourself, how am I experiencing this pain? There's, chest pain or whatever it is. I keep going back to the same thing. Can I allow myself to feel this? And very quickly, you'll probably notice that parts of you do not want to. You're going to notice immediately, maybe, parts of you fearing the pain. And then, as is always the case in your self-practice, if the next thing you notice is fear towards your symptoms, fear towards your body, you then go, can I allow my fear? Let's let my fear be here. How can I make space for my fear? And the mindfulness practice is a body-based practice. So how it differs from the IFS therapy. In the IFS therapy, maybe you'll be asking the fear why it's afraid, unpacking it, asking where its fear first started. There's a lot of unpacking in IFS therapy about the origins of emotions, etc. In mindfulness, you don't really have to do that. You just have to notice how fear is showing up for you in the moment and be with it. If you notice fear showing up for you as this flightiness in the chest, you do your best to just allow the flightiness in the chest. If you notice fear showing up just as thoughts, but you notice nothing in the body, you just let yourself feel nothing in the body. You're like, okay, I'm experiencing fearful thoughts. I don't feel much in the body, but I'm just going to allow my body to feel nothing. Over and over again in your self-practice, you're doing your best to notice what's there, and you're coming back to the body and allowing the body to feel that way. Even if you can't describe what the emotion is, even if you're not quite sure what the emotion is in that moment, allow yourself to just feel the thing. The current state of being is something, I'm not quite sure. Maybe what I'm experiencing is uncertainty right now. I'm just going to let myself experience that. And one by one, you start to experience more things in the body. And like I said with the IFS therapy, it's not like you have to notice everything at once and just keep hold of everything. It happens like a conveyor belt. So in each millisecond of the mindfulness practice, you're like, now I'm experiencing fear. How am I experiencing it? I'm coming back to the body, let myself feel this fullness in my chest. And what's the result of me allowing this? Well, now I'm maybe feeling a bit restless. I'm going to let myself feel restless. What's the result of feeling restlessness? I feel a bit resistant. I feel like I want to come out of the meditation. Now I'm going to let myself feel resistant. I'm going to notice how resistance is showing up for me right now in the body. I'm going to let myself experience that. It differs from IFS therapy in the fact that you needn't unpack the emotions in the same way that you do in the IFS therapy. You just have to come back to the body, notice what's there. Whether you can label the emotion or not, it doesn't matter. Just allow the body to experience whatever it is that it's experiencing in each given moment. There aren't any wrong turns. Even if you notice yourself You can't allow the fear and you're resistant to it. Allow the resistance. Each millisecond is how it needs to be. It's meant to be uncomfortable. I got to the point where I celebrated discomfort in my meditation because I knew this is what we needed to feel. People learn this and then they go into their meditations and they're quite boring. So this is what to expect from meditation. You're not going to, in meditation, compared to IFS therapy. With IFS therapy, I'm constantly there bringing you back. I'm constantly there saying to you, come back to this. What's coming up for you now? Let's explain it. So I'm there to keep your attention on what's arising. In your self-practice, you're going to notice you're distracted a lot of the time. You're going to go off into thoughts. And over again, you're going to need to bring yourself back to the body. You may only get 2 seconds every now and then in the body. You may get moments in your mindfulness practice where you're aware of what's going on and you're practicing allowing it to be there. That's okay. The real value from this practice is closing the eyes and showing the mind and body that I'm here. I'm here for us. I'm here to be in this. So it differs from IFS therapy in the fact that you may not have a lot of attention on what's arising. You may get distracted a lot. But every time you get distracted, just bring yourself back to your experience over and over again. Let's say other things that are arising. I really want to make this point of the breath. That the breath may feel, shallow. The breath may not feel good in your meditation practice. I'm aware that I'm saying lots of different things, so definitely go back through the video if you need to, and for sure write notes if you need to as well, but I'm going to keep going. We're taught in meditation to slow down the breath, whereas in this mindfulness practice, traditional mindfulness practice to get relief from chronic symptoms, we learn that if the breath feels the way it does, shallow, let's let the breath feel this way. Let's let ourselves feel afraid. If suddenly we feel nothing and a part of us is trying to excavate emotion and trying to search for emotion and trying to bring up emotion, we teach that part, okay, I get that you're doing that, but we don't need to do that. We're just going to let this experience be the same. Your experience can be the same over and over and over again. It can just be a shallow breath throughout. It could just be pain throughout. It could be fear throughout. It could be nothingness throughout. I'm trying to distill a whole mindfulness teachings in this visual. So there's lots of different things that we could experience. Nothingness is definitely something that a lot of people report, or numbness, or the fact that it's boring and nothing's happening. That's an uncomfortable state to be in. Let yourself be bored. Let it be nothing. Your nervous system in your self-practice in mindfulness will not allow you to feel more emotion until you're first okay feeling nothing. Until you're first okay just, this is okay. Until you're first okay just with a shallow breath and you're not trying to calm it down all the time. Until you're first okay with the fact that there's a resistance here and I'm going to let this resistance be here. You're noticing more and more in each mindfulness practice. And then you show up the next day and it goes bloop, it does that again the next day. And you've got to go through the whole process again. And every single day you do this. Every single day you're just practicing acknowledging what's there and trying to allow it to be there. Some meditation practices are going to be nothing the whole way. They're going to be boring the whole way. Or it's going to be fear the whole way. It's going to be pain the whole way. Over and over again, you show up for yourself. You may be distracted the whole meditation and only get like 1 minute of paying attention. There's still value in that. You're still showing the mind and body, I'm showing up for myself. This has a regulating effect on the nervous system over time because you're reconditioning the mind by doing this every day, that we're teaching ourselves to be safe with the sorts of things that we have taught it for years, maybe decades, that we're not safe with. It's okay that we're bored. It's okay that the breath won't feel calm. It's okay that we're restless. It's okay that we're afraid. It's okay that we don't like any of those states of being. Allow all the paradoxes. To give you an example of what it looks like when someone uses mindfulness to try and relax instead of to allow what's there, is they'll start like this. And then let's say they'll notice a shallow breath. And then the invitation will be, calm the breath down. So immediately what they'll be doing is they'll be not allowing what's there. They won't be just let themselves feel the shallow breath. And they'll just do this every single time. The whole meditation just becomes this. If you're using meditation to try and relax, you'll start to acknowledge more of what's there, and then you'll slow down the breath because I don't like what's here. You'll start to notice a bit of fear, and then, oh, I'm resistant of this. and I don't like this fear, and I'm going to try and calm it down. All you're going to be teaching the mind and body by using meditation to soothe is nothing is safe that I'm experiencing, because I'm trying to change it. I'm trying to slow down the breath. I'm trying to relax the whole time. If it gets too uncomfortable, I come out, when in actuality you're meant to feel the discomfort. So I'm fairly certain that that's all I wanted to share. The expectation, again, from the mindfulness practice is that you have to do it consistently. It doesn't matter if the emotions, like I said before, it doesn't matter if the emotions are unhelpful, irrational, inappropriate. Your mind and body doesn't care. It latches onto different stories of the emotions, but all it wants you to do is learn to feel the energy of the emotion. And what I mean by energy is how you experience it in the body. Whether you experience it in a big way or you experience it as nothingness in the body, that's okay. It doesn't matter if you're really angry at your kids and then really guilty at your kids. It doesn't matter what the subject is. Let the body experience anger. Notice the parts of you resisting the emotion, because it says, that's inappropriate, that's unhelpful, that's irrational, that's not going to help us. This will very much happen with you at the beginning with things like fear and restlessness and shallow breath, because you're used to watering it down all the time. And in your mindfulness practice, like I said before, for 10, 20, 30 minutes a day, you're surrendering to all the states of being that society has told you not to surrender to. It's told you to water down. So that's why this practice takes time. It's a skill. It takes time to learn. So I'm so wary of leaving anything out in this video. I know I can create a part 2, but this is a visual that I show people in not such a hurried way at the end of a session. Usually I just show them what just happened in their session, so it's very much related to them. And they go, oh my God, I never realized I was doing that. The circle represents the focus, and it represents the regulating of the nervous system. We don't get to a place, by the time we get better from chronic symptoms is when we don't care, we're indifferent. We don't care if we have symptoms. We don't care if we have emotions. We don't care how the breath feels. We're generally not so concerned about what's happening for us emotionally or physically. But we only get to that place because we first allowed ourselves to feel fear. We first allowed ourselves to feel restless. You no longer fear your symptoms. You no longer fear your emotions because you first allowed yourself to experience fear. Really try and understand that. You don't just suddenly decide, I'm not going to fear this. You notice that there's fear there. You learn to allow it to be there. And then you notice through the IFS therapy process, through learning to meditate in a self practice, that the lifespan of an emotion is fairly quick. You may allow yourself to experience fear and it gets big and intense and the body may shake and it may not be so comfortable, but before you know it, you're suddenly then experiencing something else. A couple minutes later, you're onto something else. You may come back to the fear, but you suddenly start to learn through these tools that emotions need to be felt, they need to be allowed, and when I do so, even if they get intense, they will pass, they will move. Anything else that I want to share? So yes, in summary, IFS therapy done one-on-one with a practitioner, it helps you to access, or it helps you to do a mindfulness self-practice. Because often if we just start with a self-practice, as you watching this may have experienced, it can all feel very abstract and we have no idea what we're doing. And we are far too afraid to allow ourselves to experience something like fear or a shallow breath or restlessness. So you come and do IFS therapy and you have someone there like me who can just gently show you that actually experiencing your irritation isn't so bad and experiencing resistance isn't so bad. And it may get bigger and scary, but let the breath get constricted and the sadness and the fear, and it's not so bad. And then the IFS therapy will show you that. And then in a mindfulness practice, even though you don't dialogue with yourself in the same way, you begin to notice that you're better able to be with the abstract of experience of mindfulness. You're able to be with fear if it's there, or you're able to be with nothingness if it's there. It's a practice, it's a skill. It can take some time to learn, which is why I set up my community to help people go through this practice. So I hope that this video helped you. I'm just going to look down at my notes to see if there's anything else that I wanted to share that I haven't done. We're not removing anything that we're experiencing. We're expanding what we're willing to feel. That's what these tools are here for. By doing so this consistently, like I said, every single day, you come back to it, and you've basically got to do this every single day. And the more that you do this, the quicker you'll notice yourself doing it. At first, maybe it kind of happens slowly, but when you meditate consistently, you'll notice you're able to do this more, and the nervous system learns over time. I guess we don't have to give him symptoms. The mind and body is giving us symptoms in the first place to purposely get us to do this. And when we start doing this more and more, it doesn't have to give us symptoms in the same way anymore. Like I said before, because a lot of people ask, but why? By learning to do this, by learning to allow all the emotions we've been taught not to feel, we start to make better decisions in our life. So the mind and body has an interest in doing so. Anything else that I need to repeat over and over again? It doesn't matter what the mind and body wants to feel the full spectrum of emotion, regardless of what's happening in our life. So the subconscious, whether in IFS therapy or mindfulness meditation, will often latch onto a memory to get us to feel angry. It's not because we need to resolve that memory. It's because we need to learn how to be okay feeling anger. So we need to learn with IFS therapy and mindfulness, it doesn't matter if the emotion is unhelpful, irrational, or inappropriate, it can be here. Nothing is bad or wrong. Even anger towards the body is allowed. It doesn't matter the subject of the emotion. Resistance is allowed, all the paradoxes. We allow everything, including the parts that don't want to allow. Allowing everything signals safety. Doing that consistently over time reconditions the mind that our emotions are okay to be here, our sensations are okay to be here, and then symptoms no longer need to occur. IFS, you'll notice more. All the emotions you've avoided show up. So there's a big thing that I definitely need to say. I've repeated a lot of different things, but what to expect with IFS therapy and mindfulness is that in doing this, your symptoms may intensify. They're called extinction bursts. I've heard them being called extinction bursts in this industry. They've been called the symptom imperative by John Sarno. I know they're called lots of different things, but when we do this, when we start to allow more of what's there, emotions and things that we haven't allowed maybe for a long, long time, we start to notice that maybe symptoms will intensify, or maybe new symptoms will show up. Not just in the session itself, but afterwards, in the preceding days. And this is a sign that things are opening and moving. I often give the analogy of a dam. If we can imagine that all our life, internally, metaphorically, there's been a dam that's been holding back all these emotions that have wanted to break through, but we've been holding them with our repression. And then through this process, we slowly but surely, the dam comes down, and because it does, the emotions come rushing through because they've been trying to get through for years. And because they rush through, that may intensify symptoms. That's why symptoms may often get worse before they get better. So that's not a problem. That's often a sign that things are moving, and this is what needs to happen. It becomes confusing to people because we've been taught in the West that a healing modality is only relevant if it gives us immediate relief. And this is not this. This is actually relearning how to relate to the mind and body. It was our birthright. The only reason it takes time is because we were never taught how to do this when we were kids. We should have been taught how to do this when we were kids, but we weren't. So in the initial mind-body process, however many months it takes, because it can often take months, you'll go through periods where you'll often notice symptoms feeling as if they're getting worse before they're getting better, or symptoms moving around in some capacity, and that's normal. If when they are intense, it feels too difficult to do mindfulness meditation, it's always okay to take a couple of days break or whatever it is that you need. So it's again why I set up the community. It's again why I need to see people one-on-one to help them through this process, what to expect in the process, and how to adjust the process so that it works for you so that you continually feel safe along the way. There may be periods where we do a lot of IFS therapy and a lot of meditation. There may be periods where we take a pause and you need to take a break from work or whatever it is. That's why I help people through it one-on-one or in the community. So you're allowing sensations, you're allowing the breath, you're allowing the discomfort. You begin to learn that the pain in your body are very much emotions that need to be allowed. So the more you do this, the more comfortable you feel, allowing yourself to feel symptoms, allowing yourself to feel emotions. Anything else? IFS therapy helps because it teaches you what to look for and how to stay with it, what to expect. It's a training for mindfulness meditation. So anyone struggling with their meditation practice, seeing an IFS therapist helps you learn how to meditate. And yes, and then the mindfulness practice is a body-based practice. It's a lot simpler than IFS therapy. You're just learning to notice the body, the breath, emotions, and over again doing your best to allow it to be there and being with whatever arises as a result of allowing things to be there. Anything else? You don't have to notice everything at once. It can be on a conveyor belt. Lots of your meditations are going to be boring and mundane. There's going to be nothingness. That's okay. Your mind and body will only start to give you new things once you're first okay with the discomfort of boredom and things, because you probably won't like the fact that nothing is happening if nothing is happening. You'll keep drifting off in your mindfulness practice. It's okay if you only catch it every couple of seconds. You don't stop fearing your symptoms by trying not to fear them. You stop fearing your symptoms because you've allowed the fear to be there, because you're no longer afraid of your fear, basically. This takes repetition, not a one-off insight. You don't have to notice everything there at once. You notice things on a conveyor belt. That is it. So, in closing, this is a skill. You can learn it. It takes time, but that's why I'm here and all my colleagues are here to help people with it. You're learning to acknowledge more of what's here, allow more of what's here, and allow what results from allowing more what's here. You'll notice more emotions. Things may get difficult before they get better. That's normal, often a sign that there's progress. And that's it. Any questions you have? I know I said lots of different things in lots of different orders. I try to repeat myself as much as possible. Maybe go back through the video and take notes if you need to, if you haven't done so already. Please ask questions below. Please share any insights below. Ask or share anything that you'd like me to add to this. I'm sure I've left something out, but like I said, this is what I often show people at the end of their session. I don't know how long I've been going for now, 20, 30 minutes. It's often not this long. It's often 5 minutes at the end of their session. I just show them that in the session, what we did was acknowledge more of what was there and practice allowing more of what's there. That regulated the nervous system. We're going to do that over and over again, and eventually symptoms won't need to show up in the same way anymore, and your life will improve. Thanks for watching, guys. Hopefully I will see you soon. If you would like any help with this, in the caption, you can join our pain relief community. You can also do some guided meditations on this YouTube channel. In the pain relief community, there are guided meditations. There's a forum. There's other people going through similar things as you. You can book a complimentary call with me as well in the caption below. So look for the Calendly link. That's it. Looking forward to hearing from you.